has got no meaning, because I think this young generation, who is the future of our OBGYN and even menopausal management, they are the ones who are going to take this ahead. So we must give them an opportunity to present their work, maybe in different fields, no matter. But this is a very good opportunity that you have got to present your work, so that you can progress. And if I'm not wrong, the council has given some marks for presentation in various scientific conferences. This conference has got some credit points from local Punjab Medical College. She's a second-year resident, and the topic is problems and pitfalls of colposcopy in post-menopausal women.
Confirmation of pre-invasive changes in the genital tract and the cervix flush with vagina, which results in difficulty in visualizing the transformation zone. This leads to misinterpretation of the lesions and failure to identify the high-grade dysplasia and basal carcinoma. This was a prospective observational study conducted in the Department of Obs and Gynae, HCRE. Study includes 30 cases of postmenopausal women with a complaint of postmenopausal bleeding, abnormal vaginal discharge, postcoital bleeding, abnormal pap smear report from outside, unhealthy looking cervix, which is clinically suspicious of malignancy. While the patients with a history of any surgery, that is LEEP or any other cervix in the past 3 months, and obvious cervical cancer were excluded. At the same visit, both pap smear and colposcopy was performed by using a classical method. Cervix was swabbed with 3% acetic acid, followed by the evolution of the acetoid areas with Lugol's iodine. Abnormal colposcopic appearances was graded according to the modified Reed index, and endocervical curating or cervical biopsy were performed wherever indicated. When there was a diagnostic dilemma strongly favoring the atrophy, estrogen therapy was administered for 7 to 14 days and colposcopy was repeated. But estrogen was not given to the patient with a pap smear report of atypical squamous cells or doubtful cases of high-grade squamous cells. Procedure and diagnostic problem of colposcopy were noted, and the best possible remedies were instituted. Statistical significance was tested by chi-square. Patient included in the study belonged to an age group of 55 to 70, with mean age of women in positive group was 58 and negative was 60.3. Maximum number of patients presented to the gynaecology with a complaint of postmenopausal bleeding, out of which 60 were taken and use a very corrective method, then the chances of misdiagnosis and missing of bleeding is very less in postmenopausal women.
How do you confirm that? If you are missing that, what is the pathology?
Final technical case of histopathology.
That you have already done that?
So there are false positive cases. There are false positive cases in the colposcopy, which was falsely taken up as negative by the colposcopy. And there is also one false negative case by which missed the colposcopy, but it was taken up by the histopathology. So colposcopy is not only the procedure, we have to go for combined.
It has to be complemented with the
cytology followed by colposcopy followed by histopathology.
You did all these things by yourself?
No, ma'am.
Somebody helped you, or did you see colposcopy? You have colposcopy?
Procedure with our senior consultant.
Yeah, you worked under them and you observed.
Yes.
Okay. So we'll call upon. Thank you.
one suggestion of
Anemia and elevated serum FSH levels of greater than 40 international units per liter. What anatomical changes that occur after menopause are decrease in the collagen content, decreased hyalinization, decrease in elastin content, thinning of epithelium, altered appearance of and function of vaginal and vulval epithelium, increased density of connective tissue, and fewer blood vessels. What is genitourinary syndrome of menopause? Genitourinary syndrome of menopause is a new term that describes the various menopausal symptoms and signs associated with physical changes of vulva, vagina, and lower urinary tract. The terms like vulvovaginal atrophy and atrophic vaginitis, which are most commonly used until recently, had limitations as it did not cover the full spectrum of symptoms, and also the terms like vulva and vagina are not used so comfortably in the social media and discussion. Genitourinary syndrome of menopause includes not only the genital symptoms and sexual symptoms, but also cover the urinary symptoms. It is an ongoing study starting from January 2017, and data of 4 months till April 2017 has been compiled. 102 postmenopausal women aged 50 years and above were enrolled in that time period. The present study included 102 postmenopausal patients attending the OPT of Government Medical College Amritsar. The following patients were excluded from the study, that is the patients with pre-existing urogenital diseases and malformation, women on hormone therapy, malignancies, women with endocrinopathy, and surgical menopause. These patients were studied and evaluated based on the history, clinical examination, and relevant investigations. Specially designed questionnaire was used to gather the data. The data so collected was analyzed for demographic parameters, parity, time since menopause, and appearance of first gender urinary complaint, results of urine analysis and culture sensitivity, and type of urinary incontinence. The results came out to be, it was seen that maximum number of patients were in the age group of 51 to 55 years, and maximum number of patients had parity 3, followed by parity 2. It was seen that the patients had first onset of gender urinary symptom 6 to 8 years after menopause, followed by 3 to 5 years after, followed by urinary incontinence, which was seen in 25% of the patients. Among the genital symptoms, vaginal dryness was seen in most of the patients. In this study, it was seen that 40% of the postmenopausal women were sexually active, out of which 16% reported with decreased sexual desire and frequency. On urine culture and sensitivity, E. coli was the most common organism that was found in 63% of the patients. In this study, burning maturation was the most common urinary symptom that was seen in 41% of the patients. Vaginal dryness was seen in 37% of the patients. 16% postmenopausal women had decreased sexual desire and frequency. On urine culture and sensitivity, E. coli was most commonly seen organism. Take home message: women spend almost 1/3 of her life in postmenopausal age. Genital urinary symptoms are chronic, progressive, disturbing, distressing, and have social implications. Genital urinary syndrome of menopause has a profound negative impact on the quality of life of postmenopausal women. Women should be made aware of these problems and treated early to improve the quality of life. Thank you. And in incontinence, mostly there is stress incontinence. If patients mostly they may have prolapse and the patients may be very stress incontinence.
Why did you take patients over 50 years only? You have selected in your inclusion criteria patients only over 50 years. You can have postmenopause in 45 also.
So mean age, actually I can select the mean age of
No,
menopause.
mean age you select after doing the study, not before. The inclusion criteria, if you go back, you have written 50 years and above patient was selected. So what was the criteria of taking 50 and above only? The criteria I found that your topic is postmenopausal. They can happen, average age in India is 46 to 47 years. So why those patients were left? Any reason for that? Or any idea in mind?
Sir, actually mostly the patients that attend the OPD, they came under 50, above 50 and 50.
No, that is true. In your you see, analysis you could have said that my patients are more than 50, but you have written inclusion criteria is more than 50 you want to include. So I couldn't understand that reason. So any reason for that? We'll be happy to learn from you.
So I suppose it's not that.
Maybe intelligent answer, you can tell. I have taken a cutoff point as 50 years. Okay, please go, we'll call the next person to come. Yeah, one more question, please.
My dear student, just let me know, did you take only the burning symptom as a part of it, or did you take, as you were talking of stress incontinence and we cannot rule out the overactive bladder, did you take into account the increased frequency of maturation as well?
Increased frequency of maturation along with the burning maturation. And
That was taken into account?
increased frequency, retained beauty.
Okay, thank you.
Cervical cancer is one of the world's deadliest but most easily preventable forms of cancer for women. According to the GlobalCan data, cervical cancer is the fourth most common cancer in women and the seventh overall, with an estimated 528,000 new cases in 2012. Every year in India, 120,000 women are diagnosed with cervical cancer. Fortunately, the natural history of cervical cancer is such that it is possible to detect it early by screening. Early intervention thereby prevents its progression into life-threatening illness. In India, the peak age for cervical cancer incidence is 55 to 59 years. Elderly women are more likely to be diagnosed at a later stage due to the lack of regular access to the gynecological care and screening. Postmenopausal women are infected with persistent oncogenic HPV, supporting the need for continued screening in them to detect pre-neoplastic lesions. Pap smear is one of the best screening tools available for preventing cervical cancer. The most widely used system for describing pap smear is the Bethesda system 2001. Pap smear cervical cytology has a sensitivity of 72% with a specificity of 94%. It is suitable for the population-based screening program. The present study is to study the findings of a pap smear in the postmenopausal women with the incidence of the pre-malignant and the malignant lesions of the cervix. Now, aims and objectives of the study were to study the different indications of pap smear in postmenopausal women, to evaluate different pap smear findings in postmenopausal women, and to find the correlation between the age of the patient and postmenopausal atrophic smears. Materials and methods. The present study is a retrospective analysis carried out in SGRD from 1st January to 31st December 2016. The study included all the postmenopausal pap smear cases taken at the Department of Obstetrics and Gynecology. After taking approval from the Institutional Ethics Committee, the data was analyzed, and each case was analyzed in detail with special emphasis on the age of the menopause, the duration of the menopause, presenting complaints, the indication for pap smear, abnormal findings of pap smear, and the pre-malignant changes in the pap smear. Now, the exclusion criteria were the women having surgical menopause, women on hormone replacement therapy, and the unsatisfactory smears. Now, results, and I've combined both the results in discussion. Cervical cancer is the commonest cancer causing death among women in the developing countries. India alone accounts for 1/4 of the global cervical cancer burden. The progression from high-grade changes to cancer cervix takes an average of about 10 years, which enables it to be diagnosed at a very early stage. The pap smear has been the method of choice for cervical screening since the 1950s, proving valuable for mass screening and enabling the detection of lesions early enough for the effective treatment. In our study, the conventional pap smears were used. The total number of pap smears taken in our institute from 1st January to 31st December 2016 were 3950. The total number of pap smears taken in the postmenopausal women during this period were 187. Satisfactory cervical smears for evaluation were obtained in only 113 cases. In 20 cases, the smears were satisfactory for evaluation, but they lacked the endocervical cells. A study conducted by Lissette and Dorati supported the view that the presence of endocervical cells is not necessary for a pap smear result to be valid and may possibly be a risk factor for cervical abnormality. Hence, these smears, they were included in our study group. The remaining 74 cases were unsatisfactory for evaluation due to low squamous cellularity, presence of obscuring blood, mucinous material. The percentage of smears reported as unsatisfactory for evaluation in various studies were 18.9% in a study conducted by Gupta and 0.5% in a study conducted by Mr. Reddy. The unsatisfactory smears were excluded from the study. The mean age in the study group was 50.6 years with a standard deviation of 4.32 years. The average duration of menopause in the study group was 3.9 years with a standard deviation of 4 years. The age groups were further categorized, and we found that the maximum number of patients were in the study group, in the age group ranging from 45 to 50 years, which accounted to 63.7%, followed by the age group of 51 to 55 years, in which there were 32 patients, accounting to 28.3%. Now, amongst all the patients, 109 cases were symptomatic, accounting to 96.4% patients. The most common symptom was discharge per vaginum in 61 cases, followed by burning micturition in 31 cases. Abdominal pain was present in 10 cases. Only 5 patients presented with a complaint of spotting per vaginum, and backache was reported in 2 patients. Cancerophobia was found in 4% of the patients. Now this is a bar graph which basically shows us the age group on the x-axis and the number of patients on the y-axis. So in the 45 to 50 year age group, we can see that the maximum patients they are presenting with a complaint of discharge per vagina. Inflammatory smears with reactive atypia were reported in 35 patients. Inflammatory smears with infections including moniliasis were seen in 6 patients. Bacterial vaginosis was reported in 5 patients. Epithelial cell abnormalities were seen in 4 cases. Ascus was diagnosed in 1 patient. The smears were reported as per guidelines specified in the Bethesda system. The total number of patients which reported negative for intraepithelial lesions were 47. This is in concordance with a study conducted by Ranabith, where women of age group between 21 to 80 years was studied, which 26% reported inflammatory smears. On post-speculum examination, normal-looking cervices were seen in 83 cases. And this is the chart which is showing the lesions. Now, atrophic smears, they were reported in 16 patients in our study group, and a chi-square analysis was applied to find the correlation of the presence of atrophic smears in the women with advancing age. No significant results could be obtained with a p-value